I'm going to be demonstrating the external rotation lag sign and the Hornblower test. The external rotation lag sign tests for a full thickness tear of the supraspinatus and infraspinatus muscle, and the Hornblower test tests for a full thickness tear of teres minor. So your patient can be either sitting or standing, and for the Hornblower test, I'm going to passively abduct and flex the arm to a 90-90 position, and then I'm going to instruct the patient to try and hold the position. And a positive test is if the patient is unable to hold the position and goes into internal rotation. So for the external rotation lag sign, I'm going to passively abduct and flex the arm to 90 with 20 degrees of scaption, and then I'm going to instruct the patient to try and hold this position. And again, it's a positive sign if the patient is unable to hold the position and goes into internal rotation. And this is a specific test, meaning that if it's a positive test result, then it is very likely that it's either supraspinatus, infraspinatus, or teres minor tear, depending on the test. Okay, I'm going to be demonstrating the drop arm test. And the drop arm test tests for a rotator cuff tear, specifically the supraspinatus muscle. So your patient can either be sitting or standing, and the therapist is going to passively abduct the arm to 90 degrees, and then ask the patient to slowly lower the arm back to his or her side. And a positive test is if the patient is unable to slowly lower the arm or they have pain during the movement. And this is equally a specific and sensitive test, so if a positive sign is indicated, then it's likely that the patient has a supraspinatus tear.
Today I'm going to be performing the lift-off test also with the internal lag sign. With this test, we're trying to assess the rotator cuff tears, specifically of the subscapularis. In this test, I'll have the position either sitting or standing, and with this I'm going to passively internally rotate the patient, placing the back of their hand onto their low back. For the lift-off sign, I'm going to ask the patient if they're able to lift their back of their hand off of their back. A positive test would be the inability for the patient to lift off. They cannot lift. And then for the lag sign, I'm going to passively lift the back of the hand off of the lumbar spine and ask them to maintain that position without my support. A positive test would be the inability for them to maintain that position falling back. The lift-off sign is very specific, and then the lag sign is very sensitive. Today we're going to be performing the belly press test. This is for the testing of the subscapularis lesions. So in this test, the patient can be sitting or standing. I'm going to place my hand onto their abdomen and ask them to place their hand over top of the abdomen. I'm going to ask them to press into their abdomen, and I'm trying to observe to see if the elbow comes straight out. A positive test would be the inability for the patient to press into the abdomen, or if their elbow moves in any direction other than straight out. This test is both equally sensitive and specific.
Okay, so today we're going to test the anterior apprehension test for the shoulder. This test looks at any anterior instabilities a person may have. So as far as your patient position, your patient can either be sitting or lying back. The therapist will passively take the patient's arm into 90 degrees abduction and 90 degrees elbow flexion. And then you'll slowly externally rotate the patient's arm. If the patient shows any signs of apprehension during external rotation, it's considered a positive test, and this test is very sensitive. Okay, today we're going to test the sulcus sign. The purpose of this test is to test for multidirectional instability in the shoulder. So what you're going to do to start, you can either have your patient sitting or standing, whatever's comfortable for them. You're going to palpate and follow the clavicle around till its connection with the acromion. When you reach the acromion, you're going to palpate the edge of the acromion. Then you're going to have your patient's arm at the side. You're going to apply distal pressure to distract the arm. And there you will measure the distance between the acromion and the glenohumeral head. If this space is more than 1 to 2 millimeters, it's considered a positive test. And the sulcus sign test is very specific.